CoQ10 is a popular supplement used to boost energy levels, protect the heart, and to reduce the side effects of statins. It's important for the proper mitochondrial function, heart health, muscle function, and more. CoQ10 is vitally important to maintaining energy levels and preventing oxidative stress throughout the body, especially in the heart. Low levels of CoQ10 can be caused by various diseases, conditions, nutrient deficiencies, and from the use of statin drugs. CoQ10 supplementation may help with heart disease, fibromyalgia, high blood pressure, mitochondrial dysfunction, migraines, depressions, Parkinson's disease, anti-aging, cholesterol levels, and more. CoQ10 is an important compound found in every cell of the body. It's a type of coenzyme. This means that it helps enzymes to work more efficiently. CoQ10 is mainly located in the membrane of the mitochondria, where it's used to make energy. CoQ10 helps to shuttle electrons into the mitochondria to produce ATP, the main form of cellular energy in the body. It's also found in cell membranes and in lipoproteins such as LDL and HDL, where it acts as a powerful antioxidant. CoQ10 stabilizes cell membranes, helping the cells to work properly. Energy-demanding organs in your body have the highest levels of CoQ10. These include the brain, the heart, kidneys, muscle, and the liver, all of which contain many mitochondria and use a lot of energy. Many different diseases and conditions, as well as nutrient deficiencies, can reduce the body's ability to make coenzyme Q10, or can cause CoQ10 to be used up faster than it can be replaced. In these cases, supplementation may be helpful or even necessary. CoQ10 is commonly supplemented to help to improve diseases that involve mitochondrial dysfunction and increased oxidative stress, like fibromyalgia, chronic fatigue syndrome, and diabetes. Supplementation may also be beneficial for heart disease, including heart failure. Some people also take CoQ10 supplements to combat the side effects of statin drugs. Athletes, on the other hand, use them to enhance performance. Coenzyme Q10 is a vital compound that helps the mitochondria to produce energy. You can check out my other video on the mitochondria for more useful supplements. The body makes about half of the CoQ10 that we need, while we get the rest from our food. Excellent sources include meat, fish, seafood. Food that contains lower CoQ10 include dairy, eggs, nuts, legumes, and vegetables. CoQ10 is mainly found in two forms in the body, ubiquinone and ubiquinol. Ubiquinone is the oxidized version in the body, and it's recycled or reduced back into ubiquinol, and vice versa. Ubiquinol is primarily responsible for the antioxidant benefits of the CoQ10, although ubiquinone may have some antioxidant potential also. Ubiquinol makes about 90 to 98% of the CoQ10 in the blood, while ubiquinone makes only a small percentage. Both forms are carried around the body by LDL and HDL. The ratio of ubiquinol to ubiquinone decreases as you age due to poor conversion between the two forms and increased oxidative stress. Ubiquinol and ubiquinone are different forms of CoQ10. Ubiquinol is the active form. CoQ10 is the ubiquinol form. It's a strong antioxidant that protects the cells and the mitochondrial membrane. The membrane that surrounds the cells contains fats that help to keep it stable. These fats can become oxidized and damaged. This causes the cell to not work as well. CoQ10 is found within the cell membrane, where it acts to prevent this oxidative damage. CoQ10 is carried around the bloodstream by lipoproteins like LDL and HDL. LDL is especially prone to becoming oxidized when it becomes more dangerous than regular LDL and can trigger plaque formation and hardening of the arteries. The CoQ10 helps to prevent the LDL from becoming oxidized. CoQ10 is processed by the liver and it's eliminated through bile. This means that people with poor liver function or blocked bile ducts who supplement with CoQ10 may accumulate higher levels in their body, increasing the risk of side effects. Check out my video on glutathione for natural ways to help your liver. For most of the studied diseases and conditions, 100 to 300 milligrams of ubiquinone divided into 2 daily doses is effective. Higher doses may be needed to see improvements in neurodegenerative diseases. Taking a dose of 1200 mg of ubiquinone daily is safe long term. Up to 3000 mg daily may be safe in the short term. However, doses above 2400 mg per day do not result in any further increased blood levels of CoQ10. Ubiquinol has a much higher absorption and would be recommended by me instead of the cheaper, poorly absorbed ubiquinone. Coenzyme Q10 is fat-soluble, meaning that it's best absorbed when taken with a meal that contains oils or fats. CoQ10 formulations that are mixed with oil are absorbed better than powders and pills. Taking vitamin C and vitamin E at the same time as taking coenzyme Q10 may reduce its absorption. Even when it's consumed with a fatty meal, coenzyme Q10 is poorly absorbed. Absorption also varies greatly between people due to differences in the gut bacteria and the ability to absorb fats. CoQ10 is often combined with vitamin E to enhance its antioxidant effects. People who supplement with CoQ10 generally report increased mental and physical energy levels, as well as improved strength and stamina. Fibromyalgia patients report decreased pain in addition to improved energy and mental clarity. CoQ10 is a popular supplement used to boost energy levels, protect the heart, and to reduce the side effects of statins. It's important for the proper mitochondrial function, the heart health, muscle function, and more. In rare cases, CoQ10 deficiency can cause weakness, fatigue, and seizures. Oral CoQ10 at 800 mg per day seems to improve the symptoms of deficiency in adults. The recommended dose in children is 30 mg per kg body weight in 3 divided doses. Mitochondrial diseases are a group of disorders caused by the mitochondria that don't function correctly. CoQ10 improves the symptoms of the mitochondrial disorders, including poor nerve function, muscular weakness, tremor, inability to exercise, cramps, and muscle stiffness. Hypertrophic cardiomyopathy is a type of heart disease where the walls of the heart become abnormally thick, causing an irregular heartbeat and making it harder for the heart to pump blood. Taking 200 mg a day of coenzyme Q10 for improved heart function, irregular heartbeat, and quality of life was effective. It was shown to reduce the heart wall thickness in 87 people who had hypertrophic cardiomyopathy. In another study of 7 hypertrophic cardiomyopathy patients, 200 mg a day of CoQ10 was able to reduce the heart wall thickness by 26%. In a 2-year study of 420 people with heart failure, taking 300 mg a day of CoQ10 reduced the mortality by 43%. A 1-year study found that CoQ10 reduced the number of people who required hospitalization for worsening heart failure. Supplementation also reduced the incidence of fluid buildup in the lungs and asthma. CoQ10 at 100 to 300 mg per day improved exercise capacity in heart failure patients by increasing the ability of the lungs and the heart to deliver oxygen to the muscles. A review of 14 studies and 2.1 thousand heart failure patients found that CoQ10 reduced the mortality by 31%, but it did not improve the heart function or the symptoms of heart failure. CoQ10 given within 3 days of a heart attack reduced heart pain, irregular heartbeat, and it improved heart function in 144 people. The number of new heart attacks as well as death was also reduced in the group taking the CoQ10. CoQ10 improves the heart health and it may prevent thickening of the heart and heart failure. It also benefits people who've experienced heart attacks and is particularly protective if given within days of experiencing one. A review of 8 studies found that CoQ10 taken before heart surgery reduced the need for drugs after the surgery and the development of an irregular heartbeat. One study found that taking CoQ10 for 2 weeks before the heart surgery helped to maintain the heart CoQ10 levels. It improved the heart function and it reduced the recovery time. Nitric oxide is a molecule that helps to improve circulation by causing blood vessels to dilate. Healthy blood vessels produce nitric oxide to allow proper blood flow and to prevent narrowing of the arteries. Free radicals, like superoxide, inactivate the nitric oxide, and this prevents blood vessels from dilating and it decreases circulation. CoQ10 neutralizes the superoxide and it increases nitric oxide. In multiple studies of over 135 people, CoQ10 at 100 to 300 milligrams per day improved blood vessel health and it increased circulation. CoQ10 supplementation increased the level of superoxide dismutase, the enzyme that neutralizes the superoxide. Supplementing with 100 milligrams of CoQ10 daily for 20 days reduced the size of platelets and it helped to prevent them from sticking together. Multiple studies of over 280 total people with high blood pressure have found that supplementing with CoQ10 from 100 to 225 milligrams per day reduces the blood pressure. Reductions in systolic blood pressure ranged from 8 to 11% and in diastolic pressure from 9 to 12%. In people with slightly high blood pressure, studies have found that CoQ10 reduces systolic pressure 3 to 4% and diastolic by 0.4 to 2%. Preeclampsia is high blood pressure during pregnancy, with swelling in the hands and the feet. Women who took 200 milligrams per day of CoQ10 20 weeks before delivery had a 20% reduction in developing preeclampsia. Another study on 197 women found a 44% reduction risk from developing preeclampsia. CoQ10 reduces levels of inflammatory compounds, including CRP and TNF-alpha. These inflammatory compounds are linked to heart disease and diabetes. In a study of 60 diabetics, CoQ10 reduced the level of the pro-inflammatory cytokine interleukin-6. CoQ10 may reduce inflammation by reducing the production of NF-kappa B. The NF-kappa B is a protein that controls genes responsible for producing inflammatory compounds. A meta-analysis of 18 studies and over 700 people found that CoQ10 reduced blood sugar in those with high and normal levels, with doses below 200 milligrams per day, and in studies no longer than for 12 weeks. An analysis of 14 studies and 693 overweight and obese people with diabetes found that CoQ10 reduced the blood sugar, the fasting and the HbA1c level, and insulin levels in doses below 200 milligrams per day. In an 8-week study of 80 people with pre-diabetes, the same dose improved insulin sensitivity without affecting blood sugar levels. In mice with diabetes, CoQ10 reduces blood sugar levels by reducing oxidative stress in insulin-producing cells, the beta cells, and increasing antioxidant levels such as superoxide dismutase and glutathione. In cell studies, the CoQ10 prevented the programmed cell death or the apoptosis in the beta cells. In lower doses, 200 milligrams per day or less, the CoQ10 may reduce blood sugar levels in people with normal and high levels by improving the insulin resistance and protecting the beta cells. High blood sugar levels in diabetes damages the nerves, causing pain, tingling and numbness, known as diabetic neuropathy. In 24 diabetics who were suffering from neuropathy, 400 milligrams per day of CoQ10 improved the nerve function and the symptoms of nerve damage. CoQ10 prevented the nerve pain and it reduced inflammation in diabetic mice. In diabetic mice, the CoQ10 prevented the nerve pain due to abnormally low blood sugar. For example, diabetes can cause brain dysfunction and altered levels of neurotransmitters such as serotonin. CoQ10 reduced the oxidative stress and it balanced the neurotransmitter levels in the brain of the diabetic rats. CoQ10 protects the kidneys and the heart from high blood sugar levels and it improves their function in the diabetic rats and mice. Male fertility is determined by the number, the count, and the quality, which is the motility and the morphology of the sperm. Sperm cells rely on CoQ10 for the energy needed to move and for its antioxidant protection. A study of 22 men found that taking 60 milligrams per day for 103 days improved the in vitro fertilization rates. A 26-week study of 212 men with infertility found that 300 mg per day of CoQ10 improved the sperm count and the motility. A slight increase in testosterone was also found. Supplementing with 400 mg per day for 6 months improved the motility in 22 men with infertility. 200 mg daily for 12 weeks reduced the oxidative stress in 47 infertile men. Poor ovarian reserve is a term that's used to describe a reduction in the quantity or the quality of immature eggs in women of reproductive age. It can reduce the success of in vitro fertilization. CoQ10 increased the IVF rate and the number of high-quality embryos in women with this condition, as well as pregnancy and live birth rate. In aging mice, CoQ10 improves the number and the health of immature eggs. In high doses greater than 200 mg per day, CoQ10 may boost fertility and sperm quality in men. More studies are needed to confirm its effects on testosterone levels in men and fertility in women. CoQ10 levels are often lower in people who experience migraines. In multiple studies, CoQ10 100 to 300 mg per day reduced the duration, the frequency, and the severity of migraines. In one study, 150 mg per day reduced the number of migraines by over 50% after 3 months. Fibromyalgia is characterized by altered CoQ10 distribution in the body and increased oxidative stress. CoQ10 levels may be high in the blood but low in immune cells. Supplementation can increase the CoQ10 levels in the immune cells, which protects them and lowers the oxidative stress. In multiple studies, CoQ10 supplementation of 100 to 300 mg per day improved the symptoms of fatigue, pain, headache, and depression. Supplementation also reduced inflammation and it improved mitochondrial function. Muscular dystrophies are a group of genetic disorders that cause muscle wasting, weakness, difficulty breathing, and poor balance. In 2 studies of 27 people with muscular dystrophy, 100 mg of CoQ10 improved their ability to walk and exercise and reduced their fatigue. In 2 12-week studies of 93 people with multiple sclerosis, 500 mg per day of CoQ10 improved the symptoms of fatigue and depression and reduced the inflammation. A class of chemotherapy drugs called anthracyclines causes damage to the mitochondria of the heart. CoQ10 protects the mitochondria in the heart. A review of 6 studies found that CoQ10 protected against the damage to the heart and the liver during chemotherapy. In a 5-year study of 81 people who had melanoma surgery, they took CoQ10 at 400 mg per day in addition to their anti-cancer drug, and they were 13 times less likely to have cancer spread compared to the anti-cancer drug alone. The CoQ10 group also had better mood and energy level. In rats, CoQ10 protects the kidneys from damage due to doxorubicin without interfering with its effectiveness. Mice who were given CoQ10 lived longer after being exposed to the doxorubicin. Peyronie's disease is a disease in which scar tissue builds up in the penis, causing curvature, erectile dysfunction, and painful intercourse. In a clinical trial of 186 people with the disease, 300 mg a day of CoQ10 reduced the scar tissue, the curvature of the penis, and it improved erectile function. Statins block the production of CoQ10 and decrease its levels. One of the most common side effects of statins is damage to the muscle, causing weakness and pain. These side effects may be due to low CoQ10 levels and often cause people to quit taking the statins. In a study of 50 people taking statins, 100 mg per day of CoQ10 reduced the muscle pain and it improved their ability to accomplish daily activities. In 20 athletes taking statins, 200 mg per day improved muscle strength. Statins can also interfere with the ability of the heart to pump blood. CoQ10 supplementation is able to reverse this and to improve heart function in people taking statins. In rats who are given statins, CoQ10 protects the muscles and the liver from damage and it improves mitochondrial health. One study in 18 people with depression found that 400 to 800 milligrams per day of CoQ10 for 4 weeks reduced the severity of depression, and it improved symptoms of sadness, fatigue, and difficulty concentrating. Another 8-week study of 69 people with bipolar depression found that taking 200 milligrams per day of CoQ10 improved the symptoms of depression, including fatigue and difficulty concentrating. Studies in mice revealed that the mitochondria don't function properly in depression. CoQ10 reduces the symptoms of depression and the stress hormones in rats. In Parkinson's disease, dopamine neurons get destroyed. Dopamine is important for movement, learning, and feelings of reward. CoQ10 levels are lower in the mitochondria of people with earlier Parkinson's disease. A trial of 80 people with early Parkinson's disease found that taking either 300 milligrams or 600 milligrams and even 1,200 milligrams daily for 16 months slowed the decline in the mental and the physical function. The greatest benefit was seen in the group taking 1,200 milligrams. In a mouse model of Parkinson's disease, CoQ10 protected dopamine-related neurons. In rats with Parkinson's, CoQ10 in combination with creatine protected the brain and prevented the loss of dopamine that occurs with the disease. Higher doses greater than 1,200 milligrams of CoQ10 for longer periods may help people with Parkinson's disease, but more research is needed. Friedreich's ataxia and familial cerebellar ataxia are hereditary diseases, and they result in problems with muscle coordination, movement, speech, and balance. A study of 97 people found that those with Friedreich's ataxia had 33% lower CoQ10 levels. In a 2-year study of 50 people with Friedreich's ataxia, CoQ10 at 600 milligrams per day and vitamin E at 2,100 international units per day improved walking ability, coordination, and speech. 6 case reports of people with familial cerebellar ataxia found that doses between 300 milligrams per day and 3,000 milligrams per day for 1 year improved strength and well-being and muscle coordination and reduced the seizure frequency. CoQ10 reduced total cholesterol, and it increased HDL cholesterol in people with heart disease. This is according to a review of 8 studies, including over 500 people. However, it had no effect on LDL cholesterol or triglycerides. CoQ10 may improve cholesterol levels in people with heart disease and triglyceride levels in people with metabolic disorders. CoQ10 reduced gum inflammation in 30 people with gum disease. When applied directly to the gums, CoQ10 improved the gum health and it reduced bleeding. Dry mouth is thought to be caused in part by reduced ATP saliva production. Supplementing with CoQ10 increases the saliva production in a study of 66 people with dry mouth. People with chronic obstructive pulmonary disease, or COPD, have difficulties breathing and lower CoQ10 levels than healthy people. In an 8-week study, CoQ10 increased the oxygen in the blood. It decreased heart rate during exercise, and it improved exercise performance in 21 people with COPD. In 41 people with bronchial asthma, a combination of CoQ10, vitamin E, and vitamin C reduced the dose of the drugs, the corticosteroids, that were needed. UV radiation from the sun causes free radical damage in the skin, leading to wrinkles. CoQ10 applied to the skin decreases the free radicals and the inflammation, and it increases antioxidant levels. It also reduces the depth of wrinkles and decreases the oxidative stress and the DNA damage due to the UV radiation. A trial of 443 elderly people took selenium at 200 micrograms per day and CoQ10 at 200 milligrams per day over a 4-year period, and they had improved vitality, physical performance, and quality of life. There's not enough evidence to say if the CoQ10 can increase lifespan, although scientists are investigating the possibility of this. One study in humans has found that levels in multiple organs, including the heart, liver, and kidneys, all peak before the age of 20 and then decrease with age. In a study of adults aged 18 to 82 years, the levels were lowest in the older adults. Another study found that young children had lower CoQ10 levels than adults aged 28 to 78 years. The CoQ10 increases the lifespan of rats, bees, and worms. On the other hand, mice deficient in CoQ10 live shorter lives. However, other studies in mice and rats have found no effect on lifespan. Non-alcoholic fatty liver disease is a liver disorder and it involves chronic inflammation. Taking 100 mg decreased the liver enzymes AST and GGT and markers of inflammation in a 12-week study on 41 people with this disorder. In rats exposed to toxins, CoQ10 reduces liver enzymes, inflammation and damage, and it increases antioxidant levels in the liver. In rats, CoQ10 prevented damage to the gut from alcohol. Non-steroidal anti-inflammatory drugs, such as ibuprofen, can cause damage to the gut. The CoQ10 reduced the gut damage by increasing antioxidant levels and boosting the levels of gut-protective prostaglandins. In a rat model of ulcerative colitis, CoQ10 improved gut health by reducing the oxidative stress and the inflammation. Osteoporosis is a disease where the bones become weak and brittle due to bone loss. The CoQ10 reduces the breakdown of bone and it increases new bone formation in the rats with the osteoporosis. In rats, CoQ10 reduced the growth of tumours in the colon and it blocked the development of precancerous lesions. CoQ10 increased the oxidative stress and reduced the cell growth in cancer cells without affecting normal cells. CoQ10 prevented cell growth and it caused programmed cell death in cervical cancer cells. Still, this doesn't tell us about the actual anti-cancer effect in living organisms. Alzheimer's disease is characterized by beta-amyloid plaque and tau proteins in the brain. In mice with Alzheimer's disease, CoQ10 reduced the oxidative stress, the beta-amyloid plaque, and the tau protein in the brain. A study of 17 people found that those who were taking 300 mg of CoQ10 daily for a week were able to pedal faster during a bicycle workout and felt less tired. However, 150 mg daily did not increase the energy output in 6 physically active people after 4 weeks. This would indicate a minimum dose of 300 mg would be needed for athletic benefits. Huntington's disease is a genetic disorder that causes physical and mental problems early in life. Mitochondria in the brain of people with Huntington's becomes damaged and doesn't work as well as it should. You can check out my video on Huntington's disease for more information on natural ways to help this condition. A study of 347 people with Huntington's found that taking 600 mg per day for 2.5 years slightly improved the mental function and the ability to handle day-to-day tasks. In a large, high-quality trial, 609 patients, the CoQ10 at 2.4 grams per day for up to 5 years did not slow the functional decline in patients with Huntington's disease. For more natural treatment of many health conditions or information on various supplements, check out my website.